Thanks for sticking with us. There are three big drivers for improving care coordination: communication, getting patients involved, and improving processes in the healthcare system. I'm joined now by Laura Shadwick, who works with Mountain Pacific Quality Health, and is going to talk about how Mountain Pacific is helping support the improvement of care coordination by focusing on those three drivers and beyond. So thanks for being with us today, Laura.
Sure.
So Mountain Pacific Quality Health is improving care coordination in our states, Montana, Wyoming, Alaska, and Hawaii. And then we also have care coordination efforts going on in Guam and Saipan. Can you just talk a little bit about what it is that Mountain Pacific Quality Health does in those communities?
Sure. I mean, the major purpose for doing coalition work and care coordination is to get various stakeholders in the community talking to each other. For years, healthcare has been siloed by payer systems. So how the work gets paid is how generally the healthcare is delivered. And so now, as healthcare is becoming more community-oriented, you have stakeholders coming together to figure out how to make that more seamless and do better care coordination for patients.
And so Mountain Pacific, specifically, what is their role then in making that communication happen?
Sure, they act as conveners. They're a neutral party, and often there's competition or various agendas at work, and it helps have a neutral party come together and bring all the entities together.
And so when all those folks come together, are there certain projects or topics of interest that they focus on in those communities?
Yes, absolutely. Really, each community is different because of the needs in that community and then also the resources that are in that community. Some projects that have been at work in some of the communities are a focus on behavioral health. There's been some gaps in care for behavioral health and substance use. So really bringing providers together, making sure that the various stakeholders know of the resources that are available, and then also identifying gaps so that they can work on issues like that. There's been work on medication safety so that there are processes in place for discharging patients and getting medications reconciled, and then also working with pharmacies in the community to improve care. There's been work on high needs, high cost patients, so complex care work, which are patients that touch many of the programs in a community and use a lot of resources. So it's been a common topic for a lot of those community entities, and it's really works well for them to focus on that.
And so you talked about those complex care patients, and I know that's a big project that is happening in Montana. Can you talk a little bit more about what exactly that project is?
Sure. Complex care patients are patients that are in and out of the hospital probably 2 or more times, and possibly have multiple ED visits in a 6-month period. So those patients tend to have chronic disease or chronic illnesses, and they also tend to have other barriers to care. So often those patients have issues like lack of transportation or housing insecurity, or not a regular source of food. And so when they have those kind of basic needs going unmet, it's hard to focus on the healthcare needs that are complex if they can't get their basic needs met. So it's really trying to wrap services around those patients so that they get the healthcare that they need.
And I understand part of wrapping those services around them is used through what's called resource teams. Can you tell us what resource teams are?
Sure. Resource teams are small teams that are made up of a nurse and some community health workers or volunteers, and those teams operate outside the walls of the hospital and the clinics. Really, they work to build trust with those patients and help identify the needs that are going unmet for that patient and wrap services around them. It's really to connect that patient with services in the community.
And how are those patients, those complex care patients, identified?
So they're identified through data and through referrals. So there's, depending on the community, the data may come from the hospital or it might come from Mountain Pacific. And then also providers can refer patients that are on their radar.
And as of right now, that project is in 3 big Montana communities, so Billings, Kalispell, and Helena. Is there any way that this project gets spread to other or impacts other complex care patients across Montana?
Yes, absolutely. That project has monthly case conferences, and we're learning. We're learning from the work that's going on right now. The field of complex care is still emerging, and so especially in rural Montana or in rural locations, there is no roadmap. This is uncharted territory. So it's an opportunity for the various programs around the state to meet and talk once a month, share best practices, share tools that are working, also give peer support on what could work with a patient or things to try to work with these rather complicated patients. So we do know that that information is being shared, and we are getting inquiries from places beyond Montana interested in our program, so it's a pretty exciting time.
So I was just going to ask that question actually. Are there elements of this program that would potentially spread to other states?
Absolutely, there's specific elements. In addition to the teams, we're using technology because in Montana, the distances to care are greater than they are in a lot of urban locations. And so we're utilizing iPads to do video chats between the team and the patients, and that is really caught on. In addition, we've used some peer veteran workers, community health workers that work with veterans and their families, because here in Montana, 1 in 10 residents are veterans. And so either you're going to be working with a patient that's a veteran or maybe a family member that's a veteran, and those pieces are getting a lot of attention.
That's great. It sounds like a great project. Thanks so much for being here, Laura, and thanks for Amy for being here too. That concludes our show this week. And thanks to you for joining us. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.